All right, great work on week one so far. I've seen some compelling discussions already, and as I noted in one of my announcements, I want to try and take this week and take what we're learning in chapter 2 and 3 and get some discussions going on the board that really focus on the current state of healthcare. Most notably, there's a lot going on in the regulatory arena that is impacting us. But let's go ahead and get started. Hopefully this lecture won't be as long as the last one. I realize you had to sit through a little bit last time, but even though it's 2 and 3 chapters, the content is much more specific versus the broad base that we covered on the previous lecture. So really, chapter 2 gets into understanding the strategic business and marketing planning process. And our objectives for this chapter are what we've talked about already. The strategic plan and the market-based business plan are different. And there is a lot of confusion. Actually, kind of saw that on some of your posts this time, that there was some confusion between the role of strategy and planning and what the heck does the marketing department really do? Age-old question. And hopefully we'll bring some clarity to that. And we'll talk about the difference between a market-based approach and a non-market-based approach. Now, the author argues that they're subtle. All argue that one is much more successful than the other. You'll notice this time as I go through the presentation, there are going to be things that I've highlighted in red. A heads up for you. I consider those very important points. Very important points that could come up later in the class when I'm going through questions and I'm trying to sit down and decide what we're going to discuss on our test. So if I'm driving a point home, if it's in red, I'm considering it extremely important to grasping the overall concept for this semester. All right, a lot of confusion over planning. I mean, there's all kinds of different plans when you get into a hospital or any business. You've got strategic plans, you've got business plans, annual plans, marketing plans, financial plans. What are they? Um, you've got to consolidate it down into a rational strategic plan. And at the core of that strategic plan, at the core of the method to get to your strategy, you've got to monitor environmental trends. You've got to monitor just overall trends out there, your operational performance, and the customer. You're going to hear me talk a lot about the customer. So really when it comes down to it, you start in that upper left corner and you set the strategy and vision based on the environment, your trends, your operational performance, your customer, and your competitors, but they're going to be in your environment and trends, and you set that strategy and vision. From that, you work your way around the circle to establishing goals, creating tactics, managing operations. Now we're getting into the business plan of the strategy, monitoring results, the operational plan on how we're doing this, and that feeds back into setting the strategy and vision. And it's a constant wheel. It's a great framework, but this is how it really works. When you really get down to it, that's a very pretty slide earlier, but when you really get down to how it applies, this was a great explanation in our text. We talk about, hey, I've got an inspiration, I've got a great idea. Let's set some goals around it. Let's plan. Well, let's test it. We're fooling around. Oops, we made a mistake. Let's readjust. Let's keep going. What I love more about this is that circle seems so clean and so process oriented. And while that may lay over your plan for the year and how you organize addressing that plan and how you organize your work within the structure of live competition, live market, you're going to tweak and adjust, and that circle may spin rapidly, and there's things in that circle that may work their way around over the course of a year or two, but you're going to have rapid change, and you're going to realize that things aren't failing. You're going to have to come up with new adjustments, and that's really what this illustrates, is within that circle you could go extremely fast, or you could methodically work your way around on possibly a 3 to 4 year goal that still becomes your true north that you're going towards, but within that circle, you're adjusting, you're reacting, and you're making changes. Basic differences between strategic plan and business plan. When you've got the corporation or the organization that sets the overall goal. I work for Ascension Health. Ascension sets some of our overall goals, and we have an overall vision of our ministry and what Ascension is going to accomplish nationally. Our Jacksonville ministry, and you'll notice I keep using the word ministry. We are a faith-based organization. We are a Catholic healthcare system. Ascension is the largest in the country and the largest not-for-profit system in the country, and we are an extension of the church. So when I talk about ministry, I'm talking about our organization. I'm talking about our region. But we'll sit and develop our strategic plan that really sits and looks higher. Our strategic plan looks at our vision, our mission, our critical success factors. How are we going to get there? It's that global arching of moving from an acute-based care company to a complete healthcare, fully integrated system that is focused on population health and focused on addressing where we're moving as a result of the Affordable Care Act and what healthcare needs to move in the future. Beneath that, we've got the business plan, and the business plan gets down to that execution. How are we going to market? How are we going to operate? What structures do we need in place for our associates, for human resources? What do we need for finance? And how do we keep that moving along? So the strategic plan, again, sets our guidepost, and then we have our daily business plan that really gets down to the nuts and bolts of execution. Basic difference one more time, and you'll notice a couple things in red. That business plan is shorter. It's tactical. It integrates our day-to-day operations. The strategic plan is long-term and visionary. Where are we in 2 years, 4 years, 10 years? This sets the course for our business. So if you really had to go to the big difference between the two, the strategic plan sets the course over a prolonged period, and the business plan integrates your day-to-day operations. Market-based versus non-market-based planning. Subtle differences, but those subtle differences change the world. Again, you've got your strategic plan both on top, but if you look at it not market-based on the left side, you see that we kind of start with our operations plan. From our operations, we go to human resources, then we go to financial, and then, oh, what's our market plan? How are we going to advertise? How are we going to get out there and reach our consumer? To the left, you'll see I've written, this is a non-consumer driven. This is old school. For many years, and even when I got into the industry in 1990, we, as an industry, knew best. We told the consumers what they needed. We told the consumers how they wanted to consume our product, not a long-term strategies for success. And the market, trends, technology, the grain of America, the diversity, everything has changed that. It's turned it upside down. And it really needs to go to the strategic plan starts with your market plan. You set your strategic plan, but you've got to assess your market first and find out what trends are out there. Then you can develop your operation plan, your human resources, and your financial plan. This is the consumer-driven model. A market-based model is consumer-driven, and you have the greatest chance of success. A non-market-based is not consumer-driven. It's old school, and in today's market, you will be left behind. Good planning links the customer. Good planning is linked to what they want. Good planning is linked to their convenience. Very quick story. I can tell you philosophically, I have a real problem with the concept of people making appointments for an emergency room. It just doesn't make sense. But today's consumers, so many do not have primary care physicians, and we've trained them for the last 20, 30 years to use the ER for minor bumps and bruises. So people come to the ER anyway. So a lot of hospitals, us being one of them, have even relinquished and said, look, we're going to put online your ability to make an appointment to come into the emergency room in an hour and 2 hours. you're not feeling good. It's not that you cut your thumb off. It's that you've got something that you need to be looked at. Your doctor isn't there. You don't have an urgent care to go to. You can make an appointment. Something I would have never done philosophically. Philosophically, I would have said, I don't want you in the emergency room. I need to have another vehicle to put you in. But people keep coming to the ER. So we found a way to take those people who normally would be triaged and sent out in the waiting room for 3 and 4 hours and said, you're not that critical. Why don't you come in 3 or 4 hours and we will do some demand management and hold your place in line. So when you come, your room's ready, you walk in, you get seen. Totally consumer driven. Planning needs to be concise. It needs to be doable. You can't create world peace. You can't have 35 tasks. You've got to have something that you can run with. It's got to be embraced by leadership, and that goes from the top all the way down. It has to be embraced and developed by the executive team, but you've got to roll it out to your directors. And they've got to understand the concept, and they have to understand the linkages. And doing that requires you to set up targets that are specifically measurable, and they're linked to your decision making. Most important, you need to update this because the market is changing and the sands move rapidly beneath our feet in healthcare today. Overall strategic and marketing model, go through the steps. I don't want to read through all of these, but really you're looking at internal and external data. You set that mission. You complete your strategy goals. You get your tactics. Now we're moving into our market and business plan. We're integrating those business plans with other entities, and then we start monitoring and controlling. This really is the circle kind of looked at a little differently, but you'll notice that step 1, step 4, and step 6, those are consumer driven, and they have to be consumer driven. We don't dictate what we're going to do today anymore. That wraps up chapter 2. Very concise, getting through it. Like I said, I didn't want to spend too much time in very specific details that we've got within chapter 2 when you talk about market-based, non-market-based, consumer-driven, non-consumer-driven. So if you've got any questions about that, feel free to post up on the discussion board your thoughts. Let's jump into chapter 3. Now we're going to delve into really what drives that and what kind of trends are happening in healthcare today that you've got to be cognizant of, and it's a great example of why you've got to be consumer driven. So we are in a competitive marketplace. Few learning objectives. The external environment affects our strategy. 20 years ago, someone may have said that to you, but they probably didn't believe it. Their talk about external environment would have been, well, Medicare and CMS, with their regulatory practice of rules changing 3 and 4 and 5 and 6 years out, broadcasting in advance for us. That day's over. The external environment are our consumers. The external environment is the demographic changes, the insurances, the mergers going on within our industry, the historically non-healthcare entities entering our arena and competing with us. So your whole environmental scan's got to look at demographic changes, regulatory changes, technological changes. I have a good friend who has created a company called Vivify Health. If you want to read something interesting and see something amazing and game-changing, look at Vivify. Vivify has Bluetooth connected devices that they send out with chronically ill patients, and there are hospital systems in the country that employ that, and they take their patients who are constantly readmitted for COPD or CHF. They put them on this, and then a single nurse monitors 100 to 150 patients every day while they're at home, so they never come back into the hospital to be readmitted, and we prevent the readmissions. That would have never happened 5 years ago. The competition and then overall market shifts, who's entering our market. No single environmental factor drives our strategy. You've got to be able to take all of that into account and absorb it and run with it. 5 sources, 5 forces. You've got the 4 forces, the 5 forces. A lot of research done in the 80s really drove this, but when you really get down to what is affecting our overall environmental trend, and I have asterisk those that are consumer driven. Corporate changes really are the only ones who aren't consumer driven, although the corporation is going to adjust based on what's happening in the market and based on these other four categories. Corporate changes can be driven for different reasons, for merger issues, for refinancing issues, different things like that. But your regulatory changes, your consumers are proactive in the government, and they're proactive in getting your state to change laws. Technology advances I just talked about. Competitive shifts. Walmart is our competitor. Walmart? Really? Yes, they are. Demographic shifts. The grain of America. The changing demographics of our consumers. The boomers. So now we're going to talk about a few of the major shifts that are going on. The baby boomers, that bell curve that has moved across America, and every time they move into a market segment from their 20s to their 30s to their 40s to their 50s, and as they age through it, they revolutionize it. They change it. Talk about travel. Talk about fitness. Talk about jeans. When the baby boomers were in jeans and wearing jeans all the time, adults didn't wear jeans. Adults and minors, that's where it came out of, but adults didn't wear jeans. They didn't wear Levi's. As baby boomers aged, the style and cut of jeans changed. You saw jeans that were cut to fit the changing adult body. And now you see baby boomers out there wearing jeans shorts. It's a societal change. It's a subtle change, but it's an example of how they reshape an entire industry. They reshaped the jeans industry. In the late 70s, you saw stretchy jeans out there, and then you saw different colors of jeans appear, and then you've seen that adapt through. And they're doing the same thing into healthcare. The AARP has become a very, very strong lobbying body, and they are demanding and reshaping healthcare today. The boomers are reshaping how they access us. They are reshaping what services they use, and they are reshaping how we are organized. In 1960, only 9% of the population was older than age 65. 13% in 2009, and it continues to grow. By 2030, there will be 72 million people over the age of 65, twice the number in 2000. Now, the interesting thing is, today, where we're at 13-14%, that 13-14% of individuals consume 80% of the healthcare in America. 13% consume 80% of healthcare. What's going to happen when that goes to 72 million? When that number doubles, what's going to happen? Because we've also got life expectancy. A person age 65 has increased, the life expectancy has increased more in the last 30 years than it did in 300. We are growing older. Technology, self-awareness, all of those factors have driven it. But we as a healthcare institution have to manage it. Our seniors are becoming more active, but we're also seeing a lot more chronic disease that you didn't used to get because you didn't live that long. So we're having to adapt and change and discuss and change our model. Because they're worried about it. This graph's a little confusing, but what it really gets down to is, what percentage of the population out there is really thinking about, what worries them in retirement. And you'll see that top bar, the rising cost of health care. That's got half of them. It's up to 65%. It's continuing to grow. Healthcare has become the looming cost that delays retirement and worries people going into retirement. 20, 30 years ago, again, you didn't see assisted living facilities. that were multidimensional, where this was a whole new market that was created, where you had these facilities where there were these beautiful condos where people could live independently, but if they got ill, there were nurses on site at the condos. There was a skilled nursing facility on site. There are hospices on site, and people moved into them and transitioned through their life in these independent and assisted living facilities until they ended up in a skilled or a hospice, all in the same community, all living together. So times change. We're also facing increasing ethnic and racial diversity here. We've got 1 in 5 Americans is African American, Asian American, or Native American, or something in between. You've just seen America as a whole change. Between 1980 and 2009, our population in the United States grew by 9%. The Latino population grew by 4 times that amount, 37%. Quick example of a hospital I worked at adapting. In Las Vegas in the late 90s, the construction boom was going on. And we had a tremendous amount of the population that came into, and there were the Latin population that came in, and basically they built Las Vegas and built the homes, and it was very much a day labor mentality that the builders were using, paying their workers. So Las Vegas had this entire cash-based society that were flush with cash because their families were working and they were making a very good living and supporting their families. They were flush with cash, but they didn't have insurance. And then you had young men coming in with young families, starting new families. We actually segmented a market because we saw what was growing out there, and then advertised in the Latin community in Spanish and established a OB program for the women that was basically a prepaid program. They came in and we said, if you come in now, you put down $2,000, or you put down $1,000 now and make payments over the next 5 months, or whatever iteration we could set up on a cash payment basis. Then we had a set of providers who we split those dollars with to provide all the prenatal care and 2 ultrasounds during that and prenatal vitamins. And then when they came into the hospital, that also covered the cost of their delivery, and it was all taken care of. There was a need in the community because they didn't have insurance and women weren't getting prenatal care. Thus, they were showing up in our emergency room, and this is where we first really got alerted to it. They were showing up in our emergency room ready to deliver and had no prenatal care. So we peeled back the onion and went to the source and then created a model around that both helped us capture market share, but again, more importantly, allowed us to get care to the patients when they needed it. We did the right thing. And we were able to set it up and set it that it did not impact their family financially, whereas it would if someone came in with no prenatal care, ended up with a neonatal baby, and ended up with $1 million in charges. We were able to intervene early. We see the states with the largest Latino population out there, and the 12 largest states. Interesting, you see the Southwest and the border states, and but then you also see it starting to grow into the North, and continuing to grow as the Latino population. This will change how hospitals in this light gray belt behave, just as the story I just told you. HIPAA. HIPAA changed everything also. HIPAA was another regulatory agency, and HIPAA impacts marketing. How can we take demographic information and use it? So if a patient comes in, those individuals can be contacted for the raising of funds, but they have to include instructions on how they opt out of future communications. The covered entity has to make reasonable efforts to make sure requests are honored. Used to be a day where if someone came to your hospital, you could reach right out to them and say, wow, you had cancer, you got better, don't you want to donate to our cancer program? We can't do that anymore. HIPAA respects their privacy. We can use their information for treatment, for payment and other healthcare activities, TPO. Fundraising is a protected class within that. Marketing is a protected class within that. That changed how we reached out to our patients. You know, there's also a little more specific on patient health information for marketing. You know, we're okay when marketing is communicated in face-to-face encounters. If we have a health fair, we can discuss, you know, information about the patients with them. When it involves products or services of nominal value. Here's a St. Vincent's Clay County lunch bag. It's a nominal value that we're giving them. When marketing is about the health-related products or services, we have to identify who is the covered entity. We have to disclose any remuneration received by us, and we have to explain once again how you opt out of future. And we have to tell them why they were targeted for communication. So HIPAA complicated the marketing, and HIPAA complicated the outreach that we do to patients that have used us in the past. Patients have rights. They have the right of written notice of the information practices. We must provide those to them. What do we do with their information? They have the right to come in and inspect their protected health information. They have a right to amend their health information. And they have a right to an accounting of disclosures for purposes other than TPO, treatment, payment, healthcare operations. Those are the three that you can always rely on for HIPAA: treatment, payment, healthcare operations. And you must disclose to the patients, if they request, any time their information has been used for anything other than that. Social media, again, you know, technology, you know, is another trend that has changed us. Look at the hospitals with social media accounts. You know, look how many out there have Facebook, and this was in 2011. If you look today in 2015, I don't think you're going to find hospitals without Facebook, Twitter, LinkedIn, YouTube. This is dated, but if I put one up there for 6 months ago, it would be dated today. Everybody's got a Facebook, a Twitter, a LinkedIn, and you're trying anything you can to get linkage with your consumer. Again, the consumers moved away from us. They seek their information through social media. We've got to migrate into the social media zone and find out how we can link with those consumers and become their hospital of choice. Consolidation. The Affordable Care Act, reimbursement, a lot of things are forcing consolidation. Hospitals and insurance companies are all merging. You've got single hospitals in town merging, you know, together. And you've got large chains, conglomerations. You've got the HCA, you've got Universal Health Services, you've got community health systems, you've got Ascension Health. The interesting thing is, health insurers now, those merged entities control just less than 70% of the total commercial health insurance marketplace. That's called dominance. You know, you've got states where Blue Cross Blue Shield is the dominant provider, and they've driven the cost down to hospitals are a basic commodity now. The other interesting thing that you see developing out there are physician cartels, where in one community you may see all the general surgeons join together in an umbrella corporation that then negotiates for all the different general surgery practices, provides human resources oversight, and provides billing oversight. But when they go to the insurance companies who banded together, you've got every general surgeon in the community banded together, and they're able to leverage and negotiate higher rates much more successfully than if they were onesies and twosies out there trying to negotiate with the big dogs. If you've got every general surgeon or 90% of the general surgeons in town that take call in the emergency room, the insurance companies have to deal with them. So physicians have changed their behavior. Hospitals then have to work with the physician cartels differently, because that cartel now controls, I use the word cartel, but it's true, that cartel now controls all your general surgeons that you rely on for the emergency room. Guess what happens if they decide they're upset with you? They could either leave, leaving you no coverage, or come back to you and double or triple the cost of what you have to pay them to cover your ER. coming at you from all directions. Global competition is changing. Thailand, Malaysia, India, 20% of the cost to provide those. And those hospitals are going out and getting Joint Commission accreditation. They've been aggressively seeking to attract patients from the United States. You want to read something? Ascension, my own employer, now has a partnership with an Indian-based company that has set up a medical city in the Caymans. And we started with a small hospital, but the plan is that will be a 1,000-bed hospital in the Cayman Islands that is specifically targeting Southeast America for Americans to come down and get lower cost health care and then recover in a beautiful setting. No one would have thought of that years ago. Competition's changing. External outcome data sources for customer search and transparency. You can look towards regulatory, self-motivated, or third-party. There's different sources that you can get your information from. Whether you're looking at a regulatory agency or whether you're just doing it yourself or whether you actually go out and hire somebody to get you those data sources. Barriers to entry. We talked a lot about barriers to entry last time. We talked about the power of buyers and suppliers, the suppliers being the implant companies. If someone has a specific implant and they're the only ones who made it, they're going to drive up the cost. They're going to change our competitive behavior and change the behavior of our physicians. Our existing competitors are out there reading the tea leaves just as we are. And then alternatives. Walmart's putting in clinics. CVS is putting in clinics. Everybody's out there trying to compete with us. Insurance companies buying hospitals and health systems and becoming fully integrated. Now, we've got other substitute services that are changing the competition landscape. There are barriers to entry. Some states have certificate of need programs. I've lived in 2 that did not and 2 that have. And that restricts the ability to expand health care until you can justify a need. A lot of argument, pros and cons. Be willing to do some things on the discussion board to talk about it. Strong brand identity. You can't compete with Mayo on subspecialty care. On cancer care, they dominate the country. They dominate the world. Distribution. How easily can people access us? You know, in the eyes of St. Vincent's in our ministry, where is a purple awning? The capital requirements. You can't just spring a hospital up out of the ground for less than $90 million. Those significant investments that are out there. We covered a lot of material today. We went through a lot. It was a 30-minute lecture. Sorry about that, but with 2 chapters, I kind of had to get through it, but hopefully I flowed through it faster for you guys. If you've got suggestions, please post them up on the discussion board. You've got thoughts on what you would like to see or how you'd like to see these lectures, feel free to email me. Other than that, keep up the good work, and let's have fun talking about these different impacts and what the environment brings on your hospital and how it reshapes your market strategy. Thank you very much.